Our final speaker speaking against the motion is Michael Cannon. He is the Director of Health Policy Studies at the Cato Institute, which is the nation's leading think tank formed around the philosophy of libertarianism, which can very crudely and primitively, simplistically be summed up as live and let live. But I suppose the question is, do you need insurance to follow through on that? Michael is arguing against, broadly and firmly against the notion of universal health coverage being the responsibility of the federal government. Michael.
We do have a moral obligation to care for those who are in need of medical care, but that's not where the disagreement lies tonight. Where we disagree is over whether universal coverage is going to help us fulfill that moral obligation, or as I will argue, make that moral obligation harder to fulfill. So you've heard a lot of things about how wonderful universal coverage will be. You've heard that it'll probably be all things to all men and women. It'll make us taller and thinner, and there won't be, and it'll save us money. So let's look at a couple of the actual likely effects of adopting universal coverage here in the United States. First off, it's not going to save us money. Yes, other countries do universal coverage, and they do it on the cheap, or they do it for less money than we do, but there's absolutely no way that can happen in the United States, and here's why. Expanding insurance coverage means more people are going to go to the doctor, more people are going to use medical services. That costs more money. The Urban Institute estimates that it would cost at least $120 billion. That's at least. It's going to cost a lot more than that. Now, with the government in control, it's tempting to think that we'd be able to ratchet that spending down over time so that we're more in line with other nations. But with the government in control of whatever universal coverage scheme you can dream up, the industry is going to prevent the government from doing just that. Art Kellermann is right. The industry does have too much influence over government spending in the Medicare program. And they use that influence to prevent the government from reducing spending, from eliminating inefficient spending, wasteful spending. They've done it for Medicare's entire history. So although it's tempting to think that we could do universal coverage and we could save money on it in the process, we would have an easier time moving the uninsured to Switzerland than we would have moving Switzerland's spending levels here to the United States. Now, you've also heard that universal coverage would improve the quality of care. We actually have some pretty systemic problems when it comes to quality here in the United States. I'm not a big proponent of the U.S. healthcare sector. The experts tell us that if you have the uninsured only get recommended, what the evidence says is the best recommended care about half of the time. But you know what? Quality problems are so systemic that people in Medicare, in Medicaid, and people in the United Kingdom's National Health Service, which is their universal coverage system, also only get quality, what the evidence says is the best care about half of the time. And the reason is that government doesn't pay for quality and has been lagging the private sector in coming up with quality improving innovations. Now in the private sector we have the same quality problem, but I'll have more to say about that in a moment. One big quality problem is that we have alarming rates of medical error here in the United States. Universal coverage is not going to help to prevent these medical errors. It's not going to help nurses read doctors' chicken scratchings and avoid the errors associated with those. It's not going to encourage physicians and other clinicians to wash their hands between patients so they're not passing on infections. Nor is it going to prevent errors by encouraging doctors to follow standardized protocols when inserting a central line. The same Institute of Medicine, I'm surprised this statistic hasn't come up today, but I'll bring it up. The Institute of Medicine, and on a commission where Dr. Kellermann served, estimated that 18,000 Americans die every year from lack of health insurance. I believe that. That seems plausible to me. The same Institute of Medicine, however, estimated that up to 100,000 Americans die every year due to medical errors in hospitals. All universal coverage is going to do is bring more people into that broken system. It's not going to do anything to fix that system. Sherry Gleed, who's the head of the Mailman School of Public Health at New York's Columbia University, wrote recently, quote, "Socioeconomic differentials in health are large and growing, and appear to be growing, in countries that have universal coverage as well as in those that do not," end quote. Now, it's true, universal coverage may save some lives. It may save this one life over here, so that seems to be something in its favor. But actually here, the news isn't even all that good, because health economists tell us that if you have $1 to spend on improving health, there's absolutely no evidence that spending that dollar on universal coverage is going to get you more of an improvement in health than spending that dollar on any number of other things, including clinics, reducing medical errors, improving nutrition, fighting poverty, or even improving education. So ironically, to vote for universal coverage does not show how much you care about your neighbor's health. It actually shows how little you care about your neighbor's health, because you're willing to forego the added health benefits that might come from from spending that dollar on some of those other strategies. Now, there is something very wrong with America's healthcare sector, something that universal coverage will not solve. You can see what's wrong with, you can see what it is, I think, when you look at the Veterans Health Administration. Now, I can't remember if this has come up already, if Professor Krugman mentioned the Veterans Health Administration, but this is hailed by people who support universal coverage as exhibiting the superiority of government when dealing with the problems presented by healthcare. I think that the VA story is very important, but I don't think it tells the story that supporters of universal coverage think that it tells. The VA has made impressive strides using electronic medical records to focus on preventive care, improving quality, avoiding medical errors. The reason is not some inherent superiority of government. The reason is really just two features of the way the VA is organized. They're called integration and prepayment. If anyone cares, we can talk about what those mean later on. But those features are not unique to the Veterans Health Administration. They exist in private health plans all over the country. You know them as plans like Group Health Cooperative, Kaiser Permanente. And those plans are using health information technologies to reduce costs, improve quality, and reduce errors. Now, why don't you have electronic medical records like you have electronic financial records? Why doesn't the hospital remember your medical history, your child's medical history, your allergies, and these sorts of things? Well, the biggest reason is America's pursuit of universal coverage. Medicare is America's great experiment with universal coverage, and it's also the largest purchaser of medical care in the nation. And Medicare actually penalizes doctors and hospitals if they use electronic medical records to reduce costs or to avoid medical errors. Electronic records help avoid duplication, but Medicare pays for duplication. So if you adopt those, you make less money. Health information technologies help to avoid medical errors, but Medicare pays for medical errors. So if you adopt those health information technologies, you lose money. So providers make less money if they do these things that are in patients' interests. Meanwhile, supporters of universal coverage are trying to keep those private health plans that use these things from participating in Medicare. Why doesn't Medicare stop paying for duplication and errors? Because government resists change. So I don't think the VA successes demonstrate government's brilliance so much as how government actually impedes the pursuit of quality, affordable health care.
Thank you, Michael Cannon.